Welcome to our channel, J&J House Call. My name is Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri. This is my wife.
Hi, I'm Dr. Jennifer Sue. I practice conventional gynecology and integrative medicine. Welcome back to our channel. Today's subject is 5 ways that can help you from getting sick, which is great to kind of cover because coronavirus pandemic has hit us. We're in week number 8 of it, and this may go on for a while, and we may want to just continue preventing ourselves from getting sick anyway for the rest of our lives. If you have not subscribed, please go ahead and do so. We love integrative medicine and keeping you healthy. So always hit that notification bell so you know when we've uploaded our next video. How we wanted to organize our talk today was for you to kind of get a grasp of how you can do these things, especially during cold and flu season, as well as now, or you can grab a few just to do every day. So we're going to divide this into 5 major categories. 1 is what we eat. Number 2 is daily life. Number 3 are supplements and botanicals. Number 4 are special people that can help you through some of these times. And number 5 is socialization. The major theme preventing yourself from getting sick is always to decrease your inflammation. Number 1, meals. We eat sometimes more than 3 times a day. What are we putting in our bodies that can help us from getting sick? And you don't have to go out and buy these all at once. Pick 1 or 2. I could think of so many easy things that you guys already probably cook with. So you want to have anti-inflammatory properties. So extra virgin olive oil, sprinkle that into your foods. You can put that into your smoothies. Turmeric actually is a very useful Indian spice that you can put into eggs, your spaghetti, you just sprinkle it on. Those are all anti-inflammatory. Then we're moving into things that sound complicated, but they're not, but they're called flavonoids. Flavonoids are a group of phytonutrients that you all love to eat already, which most of us love chocolate, but we're talking about high content cacao. So you have to have cacao that's at least 70%, cacao that's high cacao content, so you can have that in your cocoa or your chocolate. Another one is resveratrol. Resveratrols are just packed with polyphenol phytonutrients, and these are in certain berries, so bilberry, blueberries, cranberries, and also red wine. But the red wine, it does depend on how long that wine has been fermented with the grape skins on the amount of benefit that you will get from that red wine. Resveratrol is also found in red grapes and purple grape juice. And another thing that you can just kind of toss into every meal is green tea. It's a great anti-inflammatory. The second area of our life is what we can do daily. Already you guys are learning to sanitize things and before we put anything in our mouth. Another thing that we can do is always practice mind-body medicine. That means getting enough sleep, which is between 7 to 9 hours at night, and also doing regular exercise, and that can be 5 minutes here, 10 minutes there, 15 minutes there, and adding it all together to 20 to 30 minutes every day, 5 times a week. So it adds up to 150 minutes per week. And the other thing is to incorporate yoga and meditation into your daily life. So again, the main theme is what? Anti-inflammation. You're kind of decreasing inflammation to boost that immune system. So the third thing is our supplements and what we can take. And just pick a couple of these. You don't have to go out and buy all of them.
So now that we're talking about supplements, I'm going to give you a little bit of background information. Number 1, there's a lot of misconception about what kind of viruses are bad for you, which ones cause colds, which ones cause the COVID-19. Just as a background, colds can be caused by a lot of different viruses. In fact, there's over 200 of them that can do that. Probably the most common ones we worry about are the rhinovirus, the coronavirus, something called RSV, and parainfluenza virus. And so all of them are already in our environment, and we get them throughout the year. And in fact, if you get admitted to the intensive care unit with suspected COVID-19 infection, you're going to be tested for 4 different coronaviruses. So this is not new to our environment. We've been exposed to this before. Now, when you start talking about what should you be taking in terms of what supplements you should be taking, what herbs should you be taking, especially during a period during influenza season or during a period like now when we may be at risk, there's some that you have to be aware of, and some people are taking these already. One is called echinacea. And that's been out for a while, and the studies show that it does stimulate the immune system and seems to help decrease the duration of the infection once you get it. Um, Now, if it does it prevent you from actually getting the colds if you're already healthy? Now that's debatable, and the evidence really isn't clear about that. But if you start feeling yourself starting to get symptoms, then it's not a bad idea to go ahead and start it.
There's people that cannot take echinacea, and these are people that are allergic to plants in the aster family. So those are the daisy family. So plants that are in the daisy family, if you're allergic to them, do not take echinacea. So these are the following plants: ragweed, chrysanthemums, marigolds, and daisies. Also, you cannot take it if you have asthma or eczema because it'll exacerbate both.
The next herb I'm going to be talking about is called Andrographis. Now, not many people have heard about it, but it's actually considered the magic herb of upper respiratory infections. And it actually tends to work a little faster than the echinacea. It does decrease the duration of the infections, and most treatment lasts from 5 to 7 days and can decrease the symptoms such as sore throat, cough, and so on. Typical dosage is 80 to 400 milligrams per day. It's typically well tolerated. The other two botanicals that have been commonly used with colds and upper respiratory infections have been elderberry and something called golden seal. Elderberry, along with echinacea, has been shown to actually decrease the duration of a lot of the symptoms that you can get, and it's actually very tasty. It has some flavonoids in it as well. Golden seal does not do that, and the studies are not as robust as you'd see with some of the others. Now, the next thing I'm going to talk about is some of the vitamins that people are starting to take and talk about. The first one is called zinc. Everybody knows what zinc is, and typically you take in a dose of around 50 milligrams a day. It has been shown to decrease the replication of the rhinoviruses, which is one of the viruses that causes colds. And several studies show that if you take this specific zinc lozenges, it can reduce the duration of the symptoms. So that's safe to take and during a period, and I'm not sure how much it prevents, but I'm taking it myself during this period. Now the next one is vitamin C. Now everybody knows about vitamin C. It shows, a lot of studies show that it does help once you get or can decrease the severity of the illness. You have to take between 1 to 8 grams per day at the first sign of a cold to actually reduce the illness or the severity of it. Now what's not clear though, is it wise to keep taking it these high doses during prophylactically if you're not having any symptoms at all? It's probably not a good idea to take really high doses. If you want to take small doses, or make sure you include certain dietary foods that have vitamin C, that's perfectly okay. In some studies, the vitamin C, when given, actually stimulated the production of interferon, which is kind of an antiviral compound that we actually produce within our own bodies. So it's found to be beneficial with that. Some practitioners say that large doses of vitamin C can help with things such as measles, mumps, mononucleosis, chickenpox, and any kind of viral infection that can result in fatigue and so on. Now, by high dose, I mean I'm talking about 50 grams to 70 grams a day, and those were typically given intravenously.
We wanted to clarify for our IV nutrient patients that you all are getting IV nutrients every week, and you're wondering, well, he just said high dose vitamin C regularly doesn't help prevent colds. But in our IV nutrients, remember, you're getting a lot more than just high dose vitamin C. You're getting a lot of anti-inflammatory and antioxidants in there too. So that's why the IV nutrients work on a weekly maintenance basis. When you're not sick, it does prevent infection.
Next vitamin is vitamin D. We've done a whole YouTube talk about that. It's typically in areas where vitamin D is low that you need to replace it. And we did talk about this in a previous video. You need to replace it with vitamin D3. It does bolster the immunity and prevents an overactive immune response. That means when we're really low, we tend to actually have a hyped up immunity. And what they found in some countries that had the highest mortality of COVID-19, such as Spain and Italy, they actually had low vitamin D. These were populations that had low vitamin D levels. So it's probably a good idea to make sure you've got at least a normal level. If you haven't had your vitamin D checked, how much should you take? Well, typically if you do 2,000 international units a day of vitamin D3, not vitamin D2 form. D2 form is cheaper, but the vitamin D3 form gets absorbed better.
So who are these special people that we keep talking about that might have like a special interest in keeping your lungs healthy? These are two groups of doctors, and they are number one, traditional Chinese medicine doctors, they love keeping the energy of our lungs clean and healthy and strong. And also, osteopathic doctors like Dr. Lucio, they emphasize the special relationship between our musculoskeletal system and our respiratory system. So the final area that you can incorporate into your life to keep yourself from getting sick is the fifth and final one, which is socialization. Socialization is so important to us because it helps us to be healthy. It's one of the pillars of health. So whether that's getting a pet, which as we learned last week, the most researched pet that showed the most benefit for our health was man's best friend, the dog. Right, Konya Bear? And number two, start reaching out and just volunteering at places if you don't have a regular job. Just being around other people does strengthen us because we're all in this world together. So the next several weeks, our topics are going to be breaking down these things that you heard about in this talk. Echinacea, cacao, flavonoids, and more. So make sure you subscribe, hit the notification bell. We love meeting with you twice a week, and we look forward to seeing you again in our next video.
So long, everybody. Thank you for joining us. See you next week.